Dr. Jeffrey Lehrman, happy Friday. WebCME wants you to start your weekend with a win. The Clinical Connection Friday feature today is athlete's foot. As a podiatrist, one of the more common things we see in our office is athlete's foot. The medical term for that is tinea pedis. Athlete's foot often presents as redness, burning, scaling, peeling, and itching to somebody's foot. It can be on the bottom of the foot, or sometimes we see it between the toes. The treatment for this is normally a topical medication. If it's on the bottom of the foot, we use an antifungal cream or lotion. If it's between the toes, we normally want to use a gel instead of a cream or a lotion. Athlete's foot may develop between the toes if it's too moist, if it's too macerated, and using a cream or a lotion can contribute to even more moisture or maceration, which would be a bad thing. So we tend to use a topical antifungal gel when it's between the toes because that gel can be more cool and soothing. Sometimes over-the-counter formulations work. However, we see many cases in our office that have not responded to the over-the-counter topicals. And if that happens, we can prescribe something stronger, a prescription strength topical, and there are studies that show that over 20% of the time, athlete's foot does not respond to the topical formulations, even the prescription strength topicals, and there's oral medication for this. So if there's an athlete's foot, a tinea pedis, that isn't responding to the topical formulations, we can prescribe an oral antifungal agent to address that. Sometimes athlete's foot even leads to blistering, which may need to be incised and drained in our office. That's another thing that can be done to treat that. So there's a wide range of treatment options. It doesn't always get better with the over-the-counter options. And sometimes athlete's foot can be mistaken for other things. If we think it's athlete's foot and it's not responding the way that we would expect it to, a biopsy can be done. A sample of the skin can be taken that's involved, and that can be sent out and evaluated. And sometimes it turns out to be something else that requires another type of treatment. That's this week's win. We hope this clinical connection will enhance your practice. Be sure to send us your questions and follow us on Facebook, Twitter, or LinkedIn. Enjoy a safe and relaxing weekend.